Communication is a basic human right, and when you can't communicate or you can't get your wants or needs met, it's a pretty big barrier to participating in our society.
Children who have communication difficulties will have problems establishing and maintaining social relationships with other children and with adults, and it may also have an impact on their academic achievement at school. For adults who are used to communicating with others throughout their lives, if all of a sudden they lose that ability, it can have a negative impact on their social connections and lead to social isolation.
Speech and language pathology is like physiotherapy, but for communication and swallowing. The Bachelor of Speech Language Pathology is a 4-year honours degree, and you come out as a graduate speech language therapist ready to enter the workforce and work in whatever area you choose.
We can work with babies from the moment they're born, children, people who have problems with speech fluency. We can also work with people who have strokes or neurodegenerative diseases, right up to people who are elderly and need some support, for example, to keep on communicating and to swallow in a safe way.
The first year or intermediate year of the program, there are 3 required courses and then 5 optional courses. At the end of that year, students apply to the professional years of the program, and that's restricted entry.
From the second year onwards, you take 8 courses a year, and 2 of those courses are hands-on clinical practice courses.
We have on-campus speech and hearing clinics, so you will see a lot of clients and get a lot of your clinical experience here at UC, and then we will send you out on various placements as well.
As part of the clinical program in the 3rd and 4th year, we have a full-time block placement, which means that you go out around Aotearoa working alongside a speech language therapist full-time for 5 weeks or 8 to 12 weeks.
It's a professional degree program, so students are learning how to be a speech language therapist. They're learning how to do a specific job when they graduate.
Our BSLP students develop excellent communication skills, great cultural safety skills, they're excellent problem solvers, they develop great reasoning skills, all things that will help them succeed as a speech therapist, but also in whatever they go on to do for their careers.
There's really strong demand for our graduates here in New Zealand, and some of our graduates also start working overseas. So our national organization, Speech Therapy Organization, has mutual recognition agreements with countries such as the US, the UK, Canada and Ireland. The vast majority of the students who graduated from the program will end up working clinically as a speech and language therapist. In New Zealand, a lot of speech therapists work for the Ministry of Education. Other students end up working in hospitals or rehabilitation centres, and some people decide to start their own private practice.
You might be interested in studying speech language pathology if you're interested in communication, so meeting new people, talking with people, supporting others, if you have an interest in health, education or science. The most important quality is being keen to work alongside people. That could be professionals in the field, doctors, nurses, occupational therapists, physiotherapists, kaiako, our teachers, our kaiwhakatikatika, and whānau, and people who need support to communicate.